Screen-Induced ADHD. I'm Dr. Trish Leigh, and I'm here to tell you why, yes, indeed, that is a thing. So, yesterday I was on, I think it must have been TikTok. I was doing some work, and I try not to go on social media platforms too much because I find that they melt my brain, but that is also part of the discussion for today. But I was on TikTok quickly, and it always serves me up things surrounding my work because that's the only reason that I go on. It served me up a video that a parent had taken of their home that their 12-year-old child destroyed their house because the parent took the phone away. And it's a video, and I don't know if this is a thing that people do because, again, I'm not really on there, but it's a video just showing how the house was completely destroyed. And it motivated me to make this video because we've had similar experiences like this in our office. My husband and I have a private practice, Leigh Brain and Spine. In the office, when we've suggested that parents decrease screen time or help their children decrease screen time, some parents take the phones away. And that really is just too much for a child who's hooked on their phone. It has to be a weaning. When the phone's taken away, they go into full-blown withdrawal, which is absolutely a thing, and throw raging tantrums because their brain needs their phone, which takes me back to screen-induced ADHD. Now, if you use your phone a lot, it will give your brain the brain pattern that is associated with ADHD, and it'll also move your brain pattern into an anxiety brain pattern. So now we've got screen-induced ADHD and screen-induced anxiety. The brain is existing out in the extremes, what I call the pendulum effect. So, in honor of ADHD month, I would love for you to help your child or yourself to decrease your screen time. In your phone, it keeps track of your screen time. So your challenge for the month is week by week to reduce that screen time amount that you are using your screen. Create more time in the real world. Make a plan to do so. Go for a walk, go for a drive, go into nature. It is so good for your brain. Make a plan, play basketball, sit outside and have tea. It's such a beautiful fall time, at least in North Carolina. It's absolutely gorgeous fall day today. So make a plan to decrease screen time while increasing time in the real world. I encourage you, don't rip the Band-Aid off because you might create withdrawal symptoms. So what we're going for is your brain's out here in the extremes of the pendulum effect because of screen time. Feelings of ADHD types of symptoms, lack of motivation, going back into screen to feel good for stimulation and for arousal. You might also feel anxiety, anxious, depressed, out here in this high extreme. Now, if you take your phone away or your child's phone away completely, your brain swings even further into the pendulum effect. It swings out. What we want is for you to gently swing in to the calm focus mode. And the way to do it is by decreasing screen time incrementally over the weeks of October in honor of ADHD Awareness Month. So make a plan. Decrease screen time, increase time in the real world. Don't rip the Band-Aid off so you don't make it worse. If you're looking for help on this journey, please reach out to me, drtrishleigh.com. We have programs that you can help yourself at home without us, or of course, if you're looking for neurofeedback training to decrease ADHD symptoms, decrease anxiety, and to help you balance screen time and get back on purpose in your real life, we got you. We are here for you. So reach out, drtrishleigh.com. And as always, control your brain or it'll control you.